Speak sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Millions left out as hospital portals lack multiple language options. Break and number 148. Patient portals have made it easier for millions of Americans to view test results, message their doctors and schedule virtual visits. But for the more than 25 million people in the US who speak little English, these tools often remain out of reach. Break greater than the University of Michigan study published October 16 in JAMA Network Open found that many hospitals offer access to their patient portal only in English, leaving many patients unable to access critical healthcare information or communicate with their providers online. Break researchers reviewed 511 hospitals in 17 states with large populations who speak limited English. In all, 29% of hospitals only offered English access to their patient portal, while 60% offered English and Spanish. Break only 11% of hospitals made their portals accessible in English, Spanish and at least one other language. Break what's more, fewer than 5% of hospitals provided their patient portal login prompts in the most common non-English, non-Spanish language spoken in their area. Break if a patient cannot log into the patient portal, what healthcare services, such as virtual visits and secure messaging with their doctor, are they missing out on and how might that impact their health? And number 157, Dr. Debbie Chen, an endocrinologist and assistant professor at the University of Michigan, said in a news release. Break hospitals with medical training programs, known as teaching hospitals, were more likely to provide multiple language options, researchers found. Break Chen said part of the problem stems from the fact that many patient portals were built long before the COVID-19 pandemic, which ramped up virtual visits. Break and number 156, my own experience as an endocrinologist using these tools to communicate with my patients, including those with limited English proficiency, inspired this study, she explained. Break while federal rules require hospitals that receive Medicare or other federal funding to provide access to healthcare services for patients with limited English, Chen said these standards don't always apply to patient portals. Break the study also found that hospitals using popular software like Epic MyChart or Cerner were more likely to offer portal access in multiple languages less than /speak, suggesting that hospitals can work with third parties to improve their accessibility. Break and number 156, the number of people in this country who have limited English proficiency is growing, Chen added. For many hospitals, patient portals are an important tool through which doctors provide care between appointments, so it is important that we make the portal accessible to all patients. And number 157. Break sources Michigan Medicine, University of Michigan, news release, October 16, 2025. Break disclaimer, statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek personalized medical advice for individual healthcare decisions. Break and copy, 2025 Health Day. All rights reserved. Break ad as a preferred source on Google. More news resources for MedWatch Drug Alerts Daily Med News for health professionals. New drug approvals, new drug applications, drug shortages, clinical trial results, generic drug approvals. Subscribe to our newsletter. Break whatever your topic of interest, subscribe to our newsletters to get the best of drugs.com in your inbox. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.